Hello, good evening, and welcome again. Thank you for stopping by. Today, I'll be talking about a social issue, and it's regarding the shortage of doctors and nurses in Canada. As we all know, the shortage of doctors and nurses in Canada is a growing crisis that significantly impacts both individuals and society. So, here is an overview of the issue, its effects, and possible interventions. So, there are some identified causes of um, shortage of doctors and nurses in Canada. One has to do with the aging population, whereby there is increased healthcare demands due to an aging population. The second cause is with regards to retirement of healthcare workers. Many doctors and nurses are retiring with fewer replacements. And the third cause is in relation to limited training and residency spots in Canada. So there are not enough medical school seats and residency positions. And another major cause is burnout and workload. So as we know, medical field tends to be really stressful. So there's high stress and long hours drive professionals to leave the field. And last but not least is that the rural and remote shortages. And this is really impacting rural areas because many professionals prefer urban areas, leaving rural communities undeserved. So, how does this impact individuals and society? Well, both with individuals and society, we continue to see long wait times whereby patients experience delays for surgeries, special specialist care and primary care, and also emergency room overcrowding, and we see that ERs are overwhelmed due to a lack of primary care access. And another cause is the declining quality of care in our system. Overworked staff leads to mistakes and lower quality patient care. And another cause that leads to the shortage of doctors and nurses has to do with increased healthcare costs. So there is more demand for emergency and urgent care increases cost. And we also have another cause which is in relation to mental and physical health consequences. With this, we see delayed care, which leads to worsening health conditions and preventable deaths. And last but not least, another impact on individuals and society is the economic impact. So there's reduced productivity due to sick individuals and an overburdened healthcare system. So, with all these, what can possibly be the intervention or interventions to address this issue? Well, so far, the areas that have been looked at are as follows: increased training and residency positions, and that will expand medical school seats and create more residency programs, especially in high demand areas. They've also looked at streamlining foreign credential recognition, which will make it easier for internationally trained doctors and nurses to work in Canada. Um, Also, improved working conditions has been looked at, and that will address burnout with better wages, reasonable working hours, and support programs. And we've we also see that another intervention discussed was incentive rural and undeserved area work. And so, with this, it will offer financial incentives um, with respect to housing support and profession and career development for professionals in remote regions. Another intervention that was looked at also was the use of technology and telemedicine, whereby they will expand virtual care to reduce pressure on hospitals and clinics. And another area of intervention looked at was or talked about was the increase to increase public-private partnerships, and this will be in a way whereby they will collaborate with private sectors to supplement healthcare delivery. And last but not least, there is another intervention which was talked about was to retain experienced staff. And in this manner, they will encourage late career professionals to remain in the workforce longer through flexible schedules and mentorship programs. So I think that these interventions will work if it's really followed, and people, professionals, and policymakers really look into it and adhere to these interventions. So, addressing this crisis requires immediate action from policymakers, healthcare institutions, and society to ensure accessible and quality healthcare for all Canadians. So, I know that we all are feeling the pinch of long waiting rooms, and it's not easy, and it has not been easy, especially for parents and the elderly, and any other person with a critical illness. So I hope that this has been helpful in some way, one way or the other, and that just serving as a reminder for anybody who will come across this video to understand some of the causes and what has been talked about and being implemented. And we hope that things improve in the medical sector, which would be a gain for every Canadian. So I want to thank you again for stopping by and for listening to my video. Thank you so much, and have a blessed evening, night, or day wherever you find yourself. Have a good one.